It isn't my fault that 58-year-old John Smoker has been inhaling 3 packs a day. People who are against free healthcare, Obamacare, in the USA. Why? This is my personal opinion. Those of us who are in favor of the Affordable Care Act, looked at Australia, Great Britain, Canada, etc. and thought that if you all could do it, so can we. It's the right thing to do. Sadly, there is nothing in place to make this act affordable here. I was horrified at the prices. For my family to receive health insurance under this act, where I live, the cheapest plan would cost us something like $600 to $700 per month. That is the lowest plan that covers almost nothing. In addition to that, there would be a $5,000 deductible per year on that plan. There is nothing affordable about that. There can be no affordable health care in the US until, and unless, something is done about the skyrocketing cost of the care itself. Simply put, the entire system is not about health care, it is about health insurance. There is a big difference there. If my tax dollars were going to actually help the poor who need to see a doctor, I'm good with that. The Affordable Care Act just dumps taxpayer money into the pockets of the CEOs that run the insurance exchanges. In my opinion, the Obamacare plan is so strongly opposed due to the socialistic aspects of it. Our Constitution gives us the rights to life, liberty, and the pursuit of happiness, and we are supposed to be in charge of how we go about doing that. I have lived without medical insurance and I was fine with that. I had one accident where I was in and out of intensive care for about 2 weeks and had a huge medical bill, but was able to pay it because our medical system inflates their prices in order to capitalize on insurance companies. The hospitals will never turn anyone away if they don't have insurance and will help to make the bill manageable. By forcing Americans to get health insurance, it will likely lead to a monopoly on insurance, which we have laws against, and it gives the federal government the ability to regulate medical care. The US was built to have a separation between the federal and state governments, and this law crosses that line in many people's opinions. I honestly don't like it, as it creates a situation where if someone is considered high risk, for example smokers, motorcycle riders, family history of illness, etc., and cannot afford even the government health care, they will be fined but still without health care. Hope that helps at least a little, as I am not an expert but have kept up on what I can. It was marketed as free and affordable health care for all. I had health care through my husband's job, it was good coverage at a reasonable price. As soon as this act passed, they switched providers and prices skyrocketed. We had a baby December 2012. The price for 3 people on his new plan is $1,000 a month. We can't afford it. Just for him and the baby it comes to $450. So I don't have health insurance. I thought, great, now I can get affordable care I need just like I was told. Nope. It's super expensive and now I need to pay a fine for the health care I can't afford to begin with. I don't know who it is helping, but for a young family struggling to get by without government aid, it does absolutely nothing. I don't think it is right to force somebody to buy a product or pay a fine. In my opinion, it is just a tax on being alive. Bureaucracy is overstepping and I really don't need more of it in my life. Healthcare should be between me and my doctor. Not me, the government, my doctor. Plus, the rates on my perfectly fine plan have increased. Why? If anything, I have actually gotten healthier in the past few years. Why should I be expected to pay for someone else's healthcare? It isn't my fault that 58-year-old John Smoker has been inhaling 3 packs a day since he was 15 and now he has cancer. Yes, the healthcare industry needs a lot of work, but slapping this giant sticker of bureaucracy and laws on top of it isn't going to make anything better. I am forced to do business with private companies, and there is something wrong about that. Something fundamentally and completely antithetical to the concept of freedom. You might say that we're forced to purchase auto insurance, so what's the difference? That would be a good argument, except I'm not forced to purchase auto insurance. If I choose to purchase and drive a vehicle, then yes, I must insure it. But I have the option to ride a bike or take the bus or work from home if I so choose. Here, with the Affordable Care Act, as a condition of living and breathing in the United States, I must be insured. That, to me, is the worst way to solve a serious problem. The simple version is that a portion of the American population doesn't want the government telling them they have to buy something. The funny thing is, Obama initially wanted a public healthcare system similar to Europe. I have no idea why anyone would oppose this, other than the fact that Republican politicians seem to be really good at getting their base to vote against their own self-interests. They made the original plan out to be socialist and blah blah blah. So, what we have now, is actually the Republican plan that Mitt Romney championed in states like Massachusetts where he was governor. They like it because it gets the free market involved in a government program. The Tea Party ultra-right want no government, or at least they think they do. I'm curious where they think our roads come from. Actually, they just want a huge military, other than that they want no government. I know it's confusing, but that's America politics. Part of it is because healthy people are paying more money for less coverage so the government can subsidize other people. I personally got incredibly screwed over. I'm 26, and in good health. I recently lost my job, due to cuts in preparation for the upcoming healthcare law changes, and have been living off of money I had saved up, which is quickly disappearing. I had been making large payments on my student loans because I had, what I thought, was disposable income. My premiums went up about 40% and my deductible went up about 20%. Here's the kicker, because I had made the money I made earlier in the year, I'm not eligible for any subsidies. I have subsequently had to move back in with my parents until I get back on my feet. Awesome. The worst part about it is that there's nothing I can do about it. I'm opposed to it because of several reasons. You don't have a right to force someone to purchase something, whether it is health insurance, auto insurance, a pony or whatever. It doesn't matter what your reasons are, you don't have that right. Forcing your will on others is the definition of slavery. I believe you can achieve better results through the market. No, healthcare in the United States is not expensive because of the free market. There is nothing free about the healthcare market. If markets were actually freed up, then you'd be able to get the coverage you want or need at a price that was affordable to you. The reliance on third-party payers is a major contributing factor to the increasing cost of healthcare. There is no personal investment in seeking cheaper coverage. When someone else is paying the bill, you don't care how much it cost. You go whenever you get a sniffle, you go to whoever you want no matter their price, you never really investigate what Dr. A charges as compared to Dr. B. If people took the time to shop for doctors like they do any other product or service, you'd see more price competition among providers, which will inevitably lead to lower prices. The continued reliance on the government for everything has eliminated personal responsibility from our society. People don't take responsibility for themselves, for their children's education, for the food they eat, the health care providers they visit, for their own financial mistakes, nothing. The main reason is because for many people, mostly middle class, it actually costs more. I think there's a big misunderstanding going around, especially for those in other countries, that ACA means free healthcare like Canada or Britain or so. But it is not even close. It is covering the costs of those who cannot afford healthcare by making everybody else pay more for it, and everyone is now legally obligated to buy it. Additionally, people are required to pay for services that do not affect them, such as a sterile male having to pay for maternity, fertility or baby care, because previous plans where they didn't have to are now illegal and would come with a fine if they didn't switch. I don't think it's been in place long enough to say if it's quantifiably good or bad, but it sure has a fair share of issues. Okay, here's my take on why it's opposed. Note that this doesn't include a lot of potentially good things it does regarding additional regulation of the insurance industry. Conceptually, you can divide the population who must abide by the ACA into three groups. Those who have been able to pay for healthcare without insurance, HC, those who had insurance before and needed it to a greater or lesser degree, IN, and those who couldn't pay for the healthcare they needed because it cost too much, COST. This last group is over 50 million people, FYI. ACA forces all three groups, HC, IN, and cost, to buy insurance or face monetary penalties. Many U.S. citizens dislike this on general principle. Personal freedom is what we're all about, and being legally required to pay private companies for something we may not need is nearly enough to start a revolt. The ACA pays for the newly provided care, for the subset of the cost group who can now get insurance, out of the money that the HC and IN groups pay because those groups are generally healthier and need less care. They are still forced to pay for insurance under the law, which creates a surplus. Also, whenever you read government subsidy in an ACA article, it's misleading. The subsidy in question isn't tax money being reallocated, it's the extra the government expects to take in from the IN and HC groups. Despite the public claims that the American people voted for this, there hasn't been a referendum on it. Rather, the president's party are claiming that Obama's re-election was confirmation of public support, along with the votes in Congress that passed the act. However, support is probably less widespread because of the way the U.S. political system currently works. Obama won re-election by 5 million votes out of 125 million cast, or about a 4% margin, which is much smaller than the number of people who can now get insurance who could not before. That's why you see people making statements about part of our population voting for a living. Their argument is that it's easier for low-income people to vote to force others to pay for their health care than it is for them to improve their financial situation and pay for it themselves. It's fairly unlikely that a simple numeric majority of U.S. citizens are in favor of this law. Note that the major reason the legislation passed the U.S. Congress is that the authors bought the support of the AARP, a powerful organization that both donates to campaigns and has a large voter turnout. By including provisions in the bill that essentially force healthy people, young people, to pay for health care for less healthy people, old and retired people, generally AARP's members. 4. At the present time, you're seeing a lot of backlash over the ACA in the news. This is because the forced insurance purchase requirement of the ACA is now effective and the general public is now learning how much they have to pay under the new rules. I think generally it breaks down like this. Cost group can now get insurance, generally qualify for subsidies, and therefore are happy, low-cost health care without working for it. Due to low income levels, these people pay few taxes as well, and generally also receive additional assistance, welfare, etc. HC group is now forced to buy insurance, paying much more money than before because their health was good, are very unhappy because they are paying more money to get less return. This group consists largely of younger people with good health but also includes people who are pro-fitness and pro-healthy lifestyle. These latter groups are extremely unhappy because they are now paying for healthcare for people who choose to have unhealthy lifestyles where before they had the freedom to choose to be healthy and were rewarded by low healthcare costs. In group, are now forced to change their insurance plan, usually paying more, sometimes much more, for the same coverage. There is and was a misconception among this group that the ACA would reduce healthcare costs for everyone, including them, or possibly raise them only a small amount. This is not the case, and this group will become more vocal as time goes on. Additionally, the increased costs are creating a fourth group. New cost, people who formerly had insurance but can no longer afford it, but must buy it anyway or face penalties, because the ACA increased their costs and they have too much income to qualify for subsidies under the ACA. For this group, it may actually make sense to leave this income level in order to afford health care. Since reducing income is much easier than increasing it, it's likely this group will fold itself into the cost group long-term by quitting or changing jobs. This will cost the other groups more money over time and have secondary effects like reducing GDP and increasing the gap between income classes. In summary, the ACA was sold as a reduction in healthcare costs and universal healthcare. In reality, it is as faulty as the government that created it. It is a program to force people with more money to pay for healthcare for people with less money. Due to the number of people involved, generally those who had insurance before will now pay more, and the freedom to choose a healthy lifestyle to reduce individuals' healthcare costs no longer exists in the U.S. Boiled down, the Affordable Care Act was supposed to represent a step towards the socialized medicine that so many other countries use to manage costs, but in reality, all it does is represent the absolute worst of both systems. I have to buy it, but I have to buy it from a private entity. It's the worst bits of socialized and private medicine handed to me, with the addendum of haha. Enjoy your fine if you don't buy it. The reality is that the US consumes 3/4 of the world's pharmaceutical supply. This comes with being on the bleeding edge of medical research. And that the systems that work so well elsewhere don't hold up here because we use too much of the world's medicine, and spend too much researching new stuff and pushing it to market. This is particularly unmanageable for a healthy young person returning to further their education after some time in the workforce. While employed at a small to medium-sized company, some 200-ish total employees, my insurance bill for medical, dental, and vision came to about $150 a month, out of a take-home check of about $3,000 a month. It was middle-of-the-road coverage, enough to get sick a couple times a year and have costs covered, see a dentist 2 or 3 times a year, and keep glasses or contacts in front of my eyes at minimal additional cost. The affordable option presented to me by the government for the same level of coverage I had through work is $305 a month for just medical without the dental coverage, and there's no options for vision. I have some savings and can actually step down to the lowest tier of coverage until I return to work because I'm healthy, but even the absolute lowest bare minimum coverage in my area costs $151 a month. I'm not necessarily upset that I have to pay an extra $11 a month for worse health coverage. I get it, such is one of the benefits of being employed. But keep in mind that those rates were affordable when I was a gainfully employed, single, middle-class worker with no dependents to support. How in the living hell is a family of 4 that pulls in less annually than I did supposed to afford a rate 4 times what I was paying? It actually works out to about 3 times with discounts, family rates and tax credits, but it's still obscene. If I'm going to assume a social cost for my medicine as a young healthy single person, something I'm totally willing to do, you have to be able to point out to me the people or families that benefit from my overpaying into the system, and at present there are none. As a final thorn in my side, it's worth noting that in addition to being mandatory, the Affordable Care Act has been pushed on a website that is woefully under-supported to handle the incoming number of questions, applications, and usage from users all over the US. So not only do we have to have this coverage by December 15th to be covered next year, the system we're supposed to use to do it is so laughably broken that 3 weeks into enrollment. My home state has only recorded some 50,000 people. Keep in mind the US total population is somewhere around 350 million. Enrolled into the program because the website is frequently down and loses applications. Government work to the rescue indeed. The biggest problem with healthcare is rising costs. Obamacare does not really do much to address this. The second biggest problem with healthcare is that it is tied to employment. Get fired, laid off, or switch jobs? Lose insurance. Obamacare does nothing to address this. The issue is in fact created by government, because they give tax breaks to companies to provide insurance. This is a tool of big corporations to squash competition, as they can recruit talent away from smaller companies by offering better insurance. The government is saying you have to buy a product from a private company. This is an absolutely terrible precedent to set. Passage and implementation of the law has been both shady and incompetent. Things like the Cornhusker kickback, where Democrats bowed David Nelson's vote with higher Medicaid funds to his state. Or Obama breaking his campaign promise to negotiate the legislation on C-SPAN in front of the people. Or the fact that the 10-year scoring of the cost of the bill used 10 years of tax revenue while only factoring in 6 years of increased expenses. Or Obama unilaterally deciding to delay the employer mandate for a year. Or companies like McDonald's getting special exemptions. Or the numerous glitches with the exchanges now that they are up. The US already has 2 government healthcare programs, Medicare, which covers everyone over the age of 65, and Medicaid, which covers everyone below a certain level of poverty. While they did expand coverage, both of these programs are chronically and criminally underfunded, to the point that doctors can no longer support a practice seeing Medicare or Medicaid patients. The government has a history of messing up healthcare in this country, from the annual fight over the doc fix to expanding spots in medical schools without expanding funding for medical residencies. We are going to see more and more medical school graduates who can't get a residency and can't practice medicine, simply because the government won't open up any funding. In general, it is a system designed to redistribute money from healthy white males between the ages of 25 to 40 who otherwise would have been fine without insurance, or with minimum coverage of catastrophic costs. As a 27-year-old single male, I still have to pay for coverage of pregnancy, women's health care including birth control, pap smears, and breast cancer screening, and pediatric care. A significant portion oppose Obamacare because they want a single-payer system. All of that being said, there are some things that I think are really good about the bill. I think the exchanges are a great way to create a more open market for healthcare. The cost control measures that are in the bill will help out. Thanks for listening to Radio TTS. Hit the subscribe button and activate the notification bell for more videos. Click the right box for the Radio TTS playlist and let us know what the next video should be about.